Hi, my name is Patrick, and today PayDirt Pete and I will be showing you the 7-site skinfold assessment. The 7-site skinfold assessment is used to determine the amount of subcutaneous fat located directly below our skin. This technique is based on the assumptions that approximately 1/3 of our total body fat is located subcutaneously, and the amount of subcutaneous fat is proportional to our total body weight. There is a plus or minus 3.5% of accuracy when predicting body fat percentages from skinfold techniques. This is assuming that proper technique and regression equations are used. Results may vary with age, sex, and ethnicity and can be affected due to error from improper technique, extreme obese and lean clients, or improperly calibrated calipers. In order to follow standardization of the technique, all measurements will be taken on client's right side. The client's skin should be dry and lotion free. As well, measurements should not be taken immediately after exercise. We will start by marking our 7 sites with pen. It is important that the client is nice and loose and not moving or tense. We will begin our rotation of measurements with the triceps, which will be located midway between the acromion and olecranon process. Next, our subscapular measurement 1 to 2 centimeters below the inferior angle of the scapula. Our mid-axillary mark will be located at the level of the xiphoid process on the mid-axillary portion. Our chest or pectoral measurement will differ whether you are a male or female. For males, it'll be 1/2 the distance between the anterior axillary line and nipple, or 1/3 the distance if you are female. Next will be our abdominal measurement, marked by 2 centimeters to the right of the umbilicus, and our suprailiac, which will be in line with the natural angle of the iliac crest taken at the anterior axillary line superior to the iliac crest. Our last measurement will incorporate the midline of the anterior thigh midway between the patella and hip. With your left thumb and index finger, you will be grabbing the skin fold 3 inches apart on a line that is perpendicular to the long axis of the marked site. The caliper in your right hand with the dial facing up. Place the jaws perpendicular to the fold 1 centimeter below the fingers, halfway between the crest and the base of the fold. Record the skin fold measurement to the nearest 0.5 millimeters 1 to 2 seconds after releasing the scissor grip. Be sure to release slowly as to not pinch your subject. The subscapular, suprailiac, chest or pectoral measurements will all be diagonal measures. Taking 2 measurements which will be averaged into the results for subcutaneous fat and body density. A retest will be required if measurements are not within 1 to 2 millimeters of each other. Be sure to rotate the 7 sites in case a need of a remeasure. This will allow time for the skin fold to regain its normal thickness. After obtaining client data for all 7 sites and retests have been performed, you can now conduct the mean, which will be an average of each site, which will be used to calculate body density. This picture displays the method in which you will use different equations to calculate body density and body fat percentage. It is important that you consider PEMDAS while working out these equations. The body density equation for males and females is displayed, as well as an example of client 1, where a step-by-step process is started for body density and continued throughout Bozak equation for body fat and Siri equation for body fat percentages. ACN's resources for the exercise physiologist was used and referenced throughout this video.